Neo-emotional release is a very integral technique. At its core, it's a psychosomatic healing technique. Emotions are literally energy in motion, emotion. Even your anxiety has a purpose for you. And if you just show it some gratitude, show it some appreciation, give it the chance to rest, it will show you actually what it's been protecting you from, which is maybe sadness, maybe anger, maybe feelings of inadequacy, low self-worth, right?
You're tuned in to the Dr. Kinney Show, and I'm your host, Dr. Erin Kinney, a naturopathic doctor and speaker dedicated to unraveling the mysteries of your body and guiding you back into balance. Let's get started. Hey everyone, welcome back to another episode of the Dr. Kinney Show. This week, I'm really pleased to have joining me Marisa Catapano, who is a fellow naturopathic doctor. She has a focus on oncology, and she is also a neo-emotional release practitioner, where she's going to share with us today what that is. And I'm really, really excited for you guys to hear about it. It's really cool. So thank you for being on the show. It's great to have you.
Thank you so much for having me. It's great to be here.
Yeah. So can we start by, can you share with listeners your journey and how you decided to become a naturopathic doctor?
Absolutely. Yeah. So I have always been drawn to the mind and just fascinated by our minds and what drives us, our thoughts, our behaviors, our actions. And so I decided to go to Boston University to study psychology. And, while I was there, I wasn't sure, do I go the medical route? Do I not? Ultimately, I decided to, but after my first year, my mother actually got diagnosed with metastatic breast cancer. And so in addition to, all of the conventional medicine that she received, she also chose to work with a naturopathic doctor. And that was really my first introduction to naturopathic medicine. And I was just amazed at the profound impacts that it had on her. I mean, even her oncologists were just blown away, not only by her vitality when she was in their office, but also the labs and the imaging that were coming back for her as someone with stage 4 cancer. And I was always just mind blown by their response to her, which was, I don't know what you're doing. I don't want to know, but keep doing it.
Keep doing it. Yeah.
And I was like, what do you mean you don't want to know? You see someone in your office doing so well. Why wouldn't you want to know what they're doing? And so I started to really think about, just how conventional medicine really tears apart the body and the mind and treats them as two very separate things. And it just seemed to me that it would make a whole lot more sense to really look at these things as a whole. And eventually my mother took me to my own naturopathic doctor, who within weeks cured the migraines I had suffered from for most of my life. So I was like, okay, there's definitely something to this. And as I looked more into, what naturopathic medicine really was and seeing, okay, it's mind, body, heart, spirit, treating all of that, looking at the connections between them and really getting to the root causes of what people are going through to help them reach greater wellness and wholeness. I just felt it in my body. I was like, this is exactly the path that I need to follow. Yeah.
It's such a cool, I don't know. I still every day I practice this medicine. I'm like, wow, I'm so grateful that this is the path I chose. Do you feel the same way?
Oh my gosh. I am absolutely amazed by what the human body can do every single day. I mean, it just seems to be the more and more that I'm working with people and practicing this medicine, the greater the healing seems to be. And it just blows me away every time.
Yeah. And I think what I loved so much about our training, and then we're going to talk more about your neo-emotional release, but it's just the way we were taught to look at the body, right? And the way we were taught to kind of get out of the body's way. It's if you take away what the body doesn't need and you give it what it does need, the body will do its thing. It will heal. It will take care of you. But we're often giving the body things it doesn't need, and we're not giving it the things it does need. And sometimes those are very basic: sleep, decent food, sunlight, rest, right? A little bit of movement, and then taking away some of the things that it doesn't like. And then again, the body, it wants to get better. It wants to be functioning optimally.
100%. And, we're also really just not taught how to listen to our bodies.
Yeah.
I mean, from a very young age, we're kind of conditioned out of listening to our own intuition and taught to follow what our parents say is okay, what our peers show us is okay versus not okay, what teachers say is okay. And so we start to really disconnect from our bodies at such a young age that it gets hard to know, like, what does my body like? What does it not like? So I think it's really like, as we get older and kind of come back to this like healing journey that so many of us are on, it's an unlearning of how we've been conditioned,
I would
right?
Totally
and then
agree.
coming back.
Yeah. Well, and also, I mean, the conditioning that we get from other people is really important, but to think about, like, we're mostly like, oh, if you have a headache, take some Advil. If you have, it's like, if you have reflux, take something that like pushes it back down. But the body is trying to tell you something with those symptoms. Like, it's always talking to us. And again, we're not, and I think it would be really cool if I try to teach this to my girls. I'm like, all right, like, when you have this means your body's trying to tell you something. Either you're hungry or you're thirsty or you're tired. Like, it's usually like basic, your body needs some basic things. Or if you have reflux, it's like you put something in there that it didn't like. I'm like, I'm going to kick that back up because I didn't like that.
Yes, exactly. Exactly. The body is, the thing that I've really come to realize is when there is dis-ease in the body is not to blame. The body is doing what it's supposed to do. The body is always trying to heal itself. It's always trying to bring you back into balance through the symptoms. So seeing these symptoms as messengers. And I think sometimes even in naturopathic medicine, we kind of look at disease as the problem, but really I feel like disease is the solution to whatever the problem is that the body is trying to solve. And so looking more truly holistically, what is the problem that the body's trying to solve by creating this symptom or this disease? And when you start to look at it that way, everything changes.
Yeah. Well, it's really just your body's always reacting to something. So it's like any symptom is your body is like, oh, I've got that going on. How can I recreate harmony over here by, like, I always think the body is like, it's going back and forth. It's like doing this things, right? Like I feel like I'm always dancing when I'm like tired. I'm like, your body's doing this and it's moving over here. And they're like, what are you talking about, Dr. Kinney? This is how I think about a body when I'm like looking at a patient. I'm okay, well, this got over here because of this. And then they had to put, like, with hormones in particular, it's like, the body, like, you were super stressed and that was suppressing the estrogen and progesterone. And then that had an effect on the thyroid. And then, you get this like down the line reaction thing.
Yes.
But, we're talking mostly about physical stuff here. But what I love about what your work does is you're looking at how emotions will affect the body. So tell us a little bit about the neo-emotional release technique.
Absolutely. Yes. So neo-emotional release is a very integral technique. At its core, it's a psychosomatic healing technique. And I really love to give the framework of, first of all, what emotions are, because I think a lot of people don't even know. So emotions are literally energy in motion, emotion. And so they're body-based reactions. They're not things that we can think or rationalize away. They're things we have to feel in the body. And they're also evolutionarily designed messengers. So when we feel an emotion, that's a reaction that the body is creating for a reason, to actually tell us something, to communicate something. And so what often happens when we're very young is something will happen and an emotion will come up, right? And there's this natural arc that emotions take where they kind of peak and then they complete and we follow down, back to our baseline. And so when something rather intense or traumatic happens, if we're not safe enough to fully feel, or we just don't have the resources to fully feel, or we were never taught or modeled how to feel and express certain emotions in a healthy way, that natural arc gets cut off. And so the emotion that never got to finish feeling, the body actually takes that on. It says, I'm going to protect you from this. I'm going to hold on to this for you. And so depending upon what that emotion was, it kind of lands somewhere different in the body. And so the skeletal muscles, the organs, the connective tissue, they all contract around that energy in motion to keep it safe. But what happens is throughout our lives, we start to repeat these patterns of not allowing ourselves to fully feel our emotions. And so every time the body takes it on and that energy just becomes really stagnant, and that stagnant energy contributes to physical, mental dis-ease. And so what we're really doing in our neo-emotional release sessions is we're finally providing the safe space for the body to show us what it has been holding on to. And so through the guidance of me as the facilitator and your presence with your own body, it opens you up to finally feeling and expressing whatever emotions have been stuck inside the body. And it's actually in the allowing of yourself to feel and to express that emotion that allows it to really release. And the body no longer has to hold on to it so tightly. And so everything can relax. And there's this beautiful opening in the system, and all sorts of physical and mental diseases just start to gently melt when that happens.
So cool. It
so really cool. Is.
It's really cool. And I think, I mean, I see this a lot. I think many of us, like, I think a lot of patients or a lot of people out there are very much aware of like how diet affects us, how stress affects us, how, not getting enough exercise. And I think I have a lot of patients that come in and, they're taking really good care of their physical bodies. They eat well, they're getting enough sleep, they're exercising, but they still have a disease state or like, chronic symptoms of some kind. And they're like, I've been to see all these doctors, I've had all these tests and we can't find anything. And that's usually when I'm like, and I'm sure you too, it's like, yes, maybe we want to look at the emotional. And sometimes you're like, wait, what? This is an emotional thing. I'm fine. And a lot of people are like, I don't have emotional issues. I'm really even. But I think that's because we've been conditioned. So, to be like, oh, well, I think for women, what was I watching? Oh, have you seen Inside Out? The movie Inside Out?
I love this movie so much.
Oh my gosh. I just went and saw it in the theaters, Inside Out 2. My kids were begging me to see it. My stepkids were, and they'd seen the first one. My kids and I had never seen it. We watched the first one last night, and I was like, this is such a cool movie. Like, I loved like the emotions running and like it moving through. But what I thought was interesting in the first one was that there was one point when it was like the mom and the dad were interacting, and it was like the dad's emotional thing was run by anger.
Yeah.
And the mom's like emotional thing was run by sadness. And I was like, that's an interesting, like, like stereotype. But, I think women, our anger, I think we were taught at a young age to like, not be angry. Like, you don't want to be a bitch, right? It's like, you want to be calm, and it's okay to be sad. It's okay to cry as a woman, but it's not maybe okay to express anger. And I think for men, and I'm generalizing, for men are often like, it's okay to be angry, it's okay to this, but it's not okay to cry.
Yes.
And, maybe you can speak to that a little bit. If that's something you see like patterning, is that, I'm sure there are kind of common patterns that you see, right?
Oh, yes, absolutely. You hit it right on the head there. And it is interesting. And I find often that, there are those people who are just like, I don't feel anything, like I'm fine. But then there's also people who are like, oh, I'm angry all the time, or I cry at the drop of a pencil, right? And so there are people that are kind of stuck in one emotion or another. And oftentimes, if we're stuck in one emotion, it's because that emotion is safe and familiar to us. And so that emotion kind of takes the protector role. So for women, when we're younger, as you said, like we have that conditioning of like the good girl. And when little girls cry, what happens? Everyone wants to come to them and hold them and just like pet their head and say, it's okay, I love you. Sadness really draws people in. And then with men and boys, it's that I'm a strong, assertive male, and like I am the protector. I'm the one who does. I'm the doer, right? And so that gets more praised versus the boy who cries is like, what are you, a wimp? Like, what are you crying about, right? So they learn that that's not okay. That's not acceptable. That's not safe. And so for both of these folks, that protector emotion oftentimes is actually keeping safe these other emotions that are underneath. So for a woman who's really in her sadness, she may need to kind of come a little bit more into her healthy anger and aggression. Whereas the man with quote unquote anger issues, right? Like that's not really an anger issue because he's fine being angry. He could be angry all day long. It's really a vulnerability issue. And so that man might actually need to come in touch with more of the softer and more vulnerable parts of him. And for men, it's tough because I think they really have a hard time letting themselves soften.
Yeah.
And making sure, of course, we can do all this great work in a session, but when folks go home, if their partners aren't accepting of these other parts of them, that's also going to be a really quick way to re-traumatize folks and just put them back into their patterns. So it's really important also that I'm giving people the tools to have these very difficult conversations with the people that they're living with, and communicating that they want to be loved and they would like to show up in their relationship a little bit differently.
Oh yeah. Do you do couples work? Do you work together with people ever?
So I don't yet, but it's funny because my fiance is actually also an emotional release practitioner. Yes. And he's a chiropractor. So basically I'm just the luckiest person in the world, but our goal is to, open our own practice together one day. And I really do see us doing a lot of more couples work because doing this work together has just deepened our connection and our ability to communicate and hold each other through life as things just inevitably come up in a way that I just honestly didn't even think was possible. And so I think to be able to bring that work and healing to other couples would just be like the next level of what we're trying to bring.
Maybe can you walk us through what a session looks like? What does it look like? What is someone going to experience? What does it feel like to do one of these sessions?
Definitely. Great question. And so every session is very unique depending upon the person. And also I'm able to do sessions in person, but also I'm doing a lot of work virtually. So the body work is a really great aspect of the session, but in settings where we're doing things virtually, rather than me placing a hand on someone or positioning their body, moving them a certain way, I'll just invite them to do that for themselves. And that tends to work quite well because in the session, it's really the inner work that is creating the most profound change. And so really beginning the session, of course, I leave some time at the session at the start to really just drop in and see where that person is at that day. How are they feeling in their body? How are they feeling? What topics are on their heart? And then diving into the session, we start really with just grounding and centering that person in their body. Because as I said, emotions need to be felt in the body. So we have to start by first connecting that mind-body awareness. And so once you kind of reach that state, folks tend to feel like they're in a deep meditation, but they're very much present with what's going on in their body. So I say the body is leading the way. It's driving the session, but the conscious mind is in the passenger seat. So it's still very much present and folks are very much aware of what's happening. And it also helps to draw those connections, right? Because it's important that if things are coming up in the body that don't always make sense to start, the conscious mind eventually puzzle pieces will start to click together. And so throughout the session, the body can talk to us in many ways. It can talk to us through physical sensations, through emotions, through colors, images, symbols, memories, thoughts, all sorts of things can come up. And so it's really just looking at whatever is present for the person in that moment. There's absolutely nothing to force. We're just meeting that person exactly where they are and just providing them, maybe for the first time, the space to actually be with themselves just as they are without needing to change anything. And that is what allows the emotions to really come up, is when you can really just be present with them. So I always say sessions range from mild to wild. Sometimes outwardly, they're quite quiet and there's more happening kind of internally. And then sometimes they are loud and expressive, and neither one is better than the other. It's truly just whatever the person needs that day. And as we go through our sessions, as that person develops trust and safety, not only with me, but with their own body, the body's able to show us more and we're able to go deeper and deeper. And so, the transformations that can occur between 1, 2, 3 sessions are really incredible, because once the body knows that you're listening and you're really wanting to understand it and love all of the parts of yourself, it will start to show you more and more. It's really incredible. Really cool.
So how many sessions do people typically need? Maybe that varies with what they have going on, or?
Yeah, absolutely varies. Of course, if there's someone with like a really strong history of trauma, I love to establish like a 6-month container, doing about one session a month with some integration in between to really make sure that we're accessing those core wounds that really need to be dealt. Other folks, sometimes it's like, it's a one and done. I just recently, I saw this 75-year-old gentleman who, that's a little bit older than the demographic I'm used to seeing, who, you don't think of them as being as open to this work, but we did a virtual session together, and he's had chronic low back pain for 30 years. And the day after our session together, he spent the whole day crying because it was the first day in 30 years that he was out of pain.
Wow.
And out of pain. And his daughter is a naturopathic doctor. So
he had tried all the things,
He had
right?
already tried. He tried all the things, the hyperbarics, the supplements, I mean, you name it. So the fact that it was able to produce that level of healing and also bring that much more emotion to him in one session was amazing, right? And so you really we never know. And we're just always listening to the body and following the body. It will always guide us into the direction we need to take.
And I think that's just like a great message for this episode. It's like, if you listen to your body will tell you what you need to know. It'll tell you what you need to get better. It'll tell you what you don't need. I feel like when I was in naturopathic school, I took craniosacral therapy training. So I was trained to do that. And one of the professors, and he was also a naturopathic doctor, and I kind of studied under him for a while. He would always say, he's like, your patients will always tell you, one, what's wrong with them. So essentially, like, they'll tell you what their diagnosis is, and they will actually tell you how to fix it. You just have to listen. You have to ask the right questions. So people, which told me, like, people actually know what's wrong with them. They don't know that they know, but they'll know. And so when someone comes in and they sit down in my office and they're like, I think I have a thyroid issue. And like, they're like, but all my thyroid tests and all my doctors, I'm usually like, that's the first I like write down. I'm like, check for thyroid. That'll be my like first thing and maybe that's not the thing. Maybe it comes up later or something else, but usually the first instinct that you have, you listeners, like the first thing, if you've got an instinct about your body, and this, you have to parse out what's a fear, because sometimes like I'm a hypochondriac and sometimes I'm like, well, maybe it's this. And I'm like, it can't be coming from a fearful place, right? It's got to be coming from like the calm, intuitive space, but you always know. We always know what's up with us. We just have to take the time to listen. And I think what it sounds like, doing this kind of work is you're getting your body into this calm state. You're accessing, part of the subconscious that knows all the things. It knows exactly what you need, right? And because really it's the subconscious that's like controlling the body. And so it's that part of our brain that knows exactly what you need, what's wrong, and what you need to do to get better. And I feel like if you can learn that, you can learn, one, how to listen to your body and learn to trust what you're hearing, then you are ultimately your own best healer.
100%. Yeah. So beautifully said. And I think a lot of folks like you're describing, they meet doctors who don't believe them when they speak, when they tell them that they feel is wrong within them. And you keep looking, because there's doctors out there who will listen to you and will believe you and will help you continue to foster that relationship with your body and help you foster that intuition and that deep level of listening. Because it's that is everything.
And I think that's one of the messages that I harp on almost every episode in this show. It's like, make sure you're working with a provider of some kind of, it could be your primary, it could be your acupuncturist, it could be your chiropractor, it could be, I don't know, your haircut or somebody that's like holding space for you that you trust and you feel safe with and is listening to you, right? Like, and that like they're gonna be like, oh wow, that's interesting. Like, let's take that into account. Versus, I think a lot of people get gaslit. No, you don't feel that way. You don't have that. Like, which is so not fair, because do they live in your body? No, they don't live in your body.
Right. Yes, exactly. And that's why, when I'm working with people in this way, so many people will be like, oh my gosh, I can't believe I'm telling you this. I've never told anyone this in my whole life. Because there is, when you bring to the table that unconditional love and that space of truly, every single part of you is welcome. There is no part of you here that is going to be judged. And we call this in the neo-emotional release world, radical unshaming of all of the parts of you. So, the parts of you that feel lust, the parts of you that feel anger, guilt, absolutely anything is welcome. And it's welcomed by me as the facilitator first, so that you can start to welcome it in yourself and really just I mean, this to me is what wholeness really is can you love and have compassion for every single part of yourself? Like even the parts of you that you don't like. Like you can love the parts of you that you don't like. And when you do, that is when the real healing happens.
Yeah. And I think particularly, I work mostly with women, men as well, but I think a lot of women, there are a lot of parts of our physical bodies we don't love. There are parts of, and I think you're doing more on the emotional one. I think, we're trained to like, it's not okay to have lust. It's not okay to be angry. It's not okay to be guilty. Not okay to feel shameful. Like we kind of put those, it's like we stuff those down it's like, let's stuff those down. We don't want to feel those things. We want to feel happy and shiny and bright and thin.
Yes.
And, right. Those are the things,
yes.
But it's okay to, it is important to love all parts. And I feel like I have this conversation with my patients a lot, particularly as it pertains to weight loss, right? I feel like it's a common thing people want to come in for. They're like, I'm trying to lose weight. And I think a lot of people are like, oh, they come in, they're like, oh, I just hate my thighs and I hate my butt and I hate this. And I'm like, your body's not going to heal if you hate it. Like, it's not going to perform for you. Just think about if you're like, if you've got a friend and you're like hating on them, they're not going to want to be your friend. Like you're being mean to them. Like they're not going to do what you ask them to. If you ask them like, hey, body, could you go like, I always talk about weight loss. Like, when if we're trying to lose fat cells, it's like trying to clean out a basement closet. No, your body's not going to go clean out the basement closet for you if you're like shaming on it all the time. So like, but when you start to love your body more, it's going to perform better for you, whatever you're asking of it, whether you're asking it to, deal with stress or you're asking for it to wake up early or you're asking for it to clean out the closet and get rid of some fat cells. Like you have to love your body. And I think, with what we're talking about, sometimes it's not easy to just flip a switch and be like, all of a sudden I love my body. You have to do this work that you're talking about because a lot of it is rooted in like deep stuff, right?
Correct. Where is the resistance to loving these parts of yourself? And that's where we begin, right? Because you can't just choose and force yourself to love yourself. I have my own personal history with eating disorder and body dysmorphia. And so I know very well, not loving my body and shame, living in such a state of shame for so long. And I actually had to allow myself to feel the shame that had been weighing me down for most of my life, unbeknownst to me. I had to actually let myself feel that shame. And it's actually in the allowing of the shame that I was able to come into greater self-love. So it's in the allowing of these more challenging emotions, of the shame, of the guilt, of the fear, the anger. When we allow ourselves to feel those things and see the beauty in feeling those things, we actually just naturally come into a state of greater self-love. And there's nothing to force about it because it just comes. And that's the difference. And I think the piece that people think it's something we have to will ourselves to do, right? Like I just decide one day I'm going to wake up and I'm going to love myself. And it's a practice. Yes. But it's also, it's a feeling of what is in the way of you loving yourself. And can you really let yourself feel that first? Because that will be your gateway to loving yourself.
So cool. It makes me also think of the Inside Out movie last night, just with like, when she's like trying to push sadness away. She was like, no, we just need joy. But then she went back and watched some of the memories and was like, oh, this happy memory only came because she was sad and she experienced this. And then people came to like comfort her. And then, that's a little bit different than what you were talking about, but kind of a similar thing. Like, I think it's so important to feel the emotions. And I say this like, this is easy. I feel like I've been working for years. Anger and sadness, I like to live in the like, I'm happy and I feel great. Like, and I think like, my family, that was kind of like, all right, well, like you better be happy. We're going to have fun and you're going to be happy. And like, and I feel like it's really a generational thing. Like my mom and I talk about this. Like, that was how her mom was. It was like, not okay to be angry. It was not okay to be grumpy. It was not okay to be like any of those things. And if you were, it was like, go away. We'll deal with it. We would like to experience you when you're in a happy place. And so you kind of learn to be like, well, maybe I feel this, but I'm going to push it away. And it's a protective mechanism, right? Because you want to be loved, right?
Yes. And it becomes subconscious, right? Like there's suppression, which is like, oh, I'm feeling really like angry about this, but like, this is not the time. So like, just get it down. And then there's the unconscious repression, which is just, it's habitual because of our conditioning. We're not even aware that we're shoving emotions down and swallowing them. It just happens. And with women, especially, I mean, my mom too, like part of the reason why I got into the emotional and the oncology work is because I'm not sure if you're familiar with like the type C personality, like, you know, the type A personality is kind of that person that's, you know, classically gets heart disease and all those things. The type C personality is like the cancer personality. And it's people who are givers to a fault, who put everyone else before themselves, who, you know, they're the peacekeepers and the homemakers, and they've always got that happy face on, and they're ignoring what is actually within them. And this was my mother to a T. And I just always knew throughout her journey, there was that deeper emotional component that she just didn't have anyone really to help guide her through. And so now this is where I am trying to bring that work, because it's the people who it's not a genuine joy, right? Like when you're forcing that smile, it's a mask. And if you pulled that mask away, what would be there? Like, well, how would you really be feeling? And when you actually allow yourself to feel that, joy comes so much more genuinely. I mean, I can't even tell you, my laugh and my smile has completely changed.
I mean, you can feel it.
I
feel
have
just
done
talking
this
to you,
work.
it's like you can feel your joy. It's right there.
It's genuine. I mean, for years, I like didn't know what my real laugh was. I was always the person who like laughed without sound coming out, because I was like, I don't really think this is funny, but like,
I'm gonna act like I'm
I should be laughing, right? Everyone else thinks it's funny. So like, haha, you know, but now I can't help but laugh and feel silly and playful and joyful, because I have felt the depths of some, you know, pretty dark emotions. But I'm so grateful, because they've been my greatest teachers. And it's allowing yourself to really feel the full spectrum. I think that's one of the greatest gifts of this human existence, is the highs and the lows. And some people are happy, you know, just living in this little window where they're not too uncomfortable, but they're not too happy. And me, I want to be feel all over the spectrum.
All the feels.
I want to feel it all, you know? And so those are the people that I love to work with too, because it's like, I've been stuck here and I just want to open myself up to more of life, to more of my own vitality. And that's really in essence what that work is all about.
Which it's really cool. And I clearly what you talked about, I think for, like you mentioned, that type C personality, but I think for any of the personalities, right? Like any, you know, if you're not, I like, my journey has been like, I'm such a good emotional repressor. I sometimes, like, I'll be in a situation and I'm like, I should probably feel something about this. I don't know what I feel yet. And it'll take me like a day. Now, I've done enough work to be like, okay, I'm going to respond later, because I don't actually know how I feel about this. Like, give me like 24 hours and then I'm going to go check in with myself and figure. But it's like, it became so conditioned that it's kind of subconscious. My body's like, well, you don't have, and it's, I think for me, it was always like, you don't have time to do it. Like in my adult life, I don't have time to break down right now. And so it's like, I'll push it away, but then it just becomes like habit. Like, oh, clearly this is an upsetting situation, but it's okay. I got to keep going. And then it becomes habit, and then you just do it over and over again. And that's when it starts to become a problem, right? Is that like
it builds and builds and builds. Yeah. And it takes, I mean, if you think of it as like every time you suppress or repress something, it's like trying to hold the lid over a pot of boiling water. And that's what the body is doing. It takes so much energy to keep the lid on that pot, to keep those emotions down. And that's a major underlying cause of chronic fatigue that people don't realize, is that their body is using so much energy and resources to just keep you from feeling
whatever it is.
Whatever it is. So actually allowing that lid to come off, and we don't have to blow it off all at once, right? But just step by step, allowing more and more to come through. It's energy starts to free up, and it can be used to clean up the basement, get rid of some of those fat cells.
Your fat cells.
Whatever it
build
needs.
Your hormones, fix your skin, make your hair grow, all the things that we want. It is also interesting. I feel like I see this a lot. I treat so many patients with anxiety and anxiety. And this is, and I've resonated with this too. It's like the anxiety element that keeps you busy. But when you're in that anxiety, like you're not feeling much. You feel anxious, but you're not in touch with any of the deeper emotions. And usually I feel like, in my work, I've learned that if I can like sit with it and like figure out what's underneath the anxiety, and usually it's sadness or sometimes anger, but typically for me it's sadness. And when I allow myself to express that, I'm not anxious anymore. And I'm like, wow, this is great. I don't feel anxious. I just needed to cry for a little bit.
Yes. It's so true. And actually, that's what Inside Out 2 really exemplified so beautifully.
Yeah, it was
right?
when anxiety showed up, and it was like anxiety, like if you let her run the show, like she doesn't let any of the other emotions come up.
That's it, right? And even anxiety, I don't know if I consider it an emotion as much of like a state of mind, but the principle and the main message of the movie was so spot on.
Yeah, it was really spot on.
Even your anxiety is serving a purpose, right? Even your anxiety has a purpose for you. And if you just show it some gratitude, show it some appreciation, give it the chance to rest, it will show you actually what it's been protecting you from, which is maybe sadness, maybe anger, maybe feelings of inadequacy, low self-worth, right? Like trying to constantly plan ahead. Like in the movie, she was like trying to reach this goal, right? And that's beautiful that it was trying to help her reach that goal. But if that's the only thing that's getting you there, you can see if you reach that goal, it's not going to be in the way that really is aligned with your core beliefs and your values. So that's why it's so important to have the whole team of emotions available.
And to let them come up and like feel the anger, and then you're done. It's also interesting. I feel like I love watching toddlers or young children, and it's like they feel an emotion, they express it, they will like go all at it, and then they're done, and then they move on, and then they're happy. And it's like, but I think with adults, we have been conditioned to not do that. And so then it just stays in there, and then, kind of weighs on us like we've been talking about. But I think we can learn a lot from watching children and how they embody an emotion, they feel it, and then they move on.
So spot on. It's like they throw their tantrum and then they're playing 2 minutes later, not even, right? Like,
yeah. You're like, wait,
I think a lot of people think once we let ourselves feel that it's like, we're never going to be able to stop. And it's just like, now we've opened the floodgates and we're just going to fall apart and stay broken forever. And it's just not the case. It's the opposite, right? Like it's never the emotion itself that's the problem. It's our resistance to feeling the emotion that causes us to suffer. And kids don't have that resistance. They don't have the shame. We're not born with shame. Shame is something that comes to us from society. And so they just feel and express as they please. But with us, we have that societal conditioning. And so that creates resistance when we're feeling something we don't think we should be feeling or we don't want to feel. And that's what really causes us the most pain.
Yeah. Well, this has been fantastic. We've touched on so many things, and I've learned a lot, and I hope everyone listening has learned a lot. Where can people find you if they'd like to work with you? Because I know you work virtually, so
absolutely,
let's tell us about that.
I do work with a lot of folks virtually. And so if you're interested in connecting, you can find me on Instagram at dr.marissa.catapano. And the office I'm working at here in Annapolis is called Chesapeake Holistic. So you can also, visit ChesapeakeHolistic.com and give the office a call if you're looking to schedule something. I always offer a free discovery call for folks who are interested to just chat more and see if it'd be a good fit for each other.
Fantastic. We'll put all those things in the show notes. And Marissa, it was great to have you on the show, and thank you for doing the work you're doing.
Thank you, Erin. It's been so wonderful. Thanks again for having me.
All right, guys, we'll see everyone next week. Have a good one. Thank you for tuning in today. If you enjoyed this conversation, be sure to connect with me on social media and leave a rating and/or a review. This helps grow the show so more people have access to this knowledge that leads to empowered healing. Love and light, and see you next week.